So let's talk a little bit today about optimizing our laboratory and imaging management systems. So really having a strong foundation of your policies and your workflows are going to be key in making sure that your test and imaging procedures are properly ordered, properly communicated. You're going to reduce all of those errors, improve your diagnostic timelines, obviously, and ultimately lead to better healthcare outcomes. What do you guys do really well? Do you have an EHR system that you're using? What do you think's working well?
It just started, but we're going to have all of the MAs assigned to the provider go through the charts at the end of the day to make sure all the referrals actually went to the referral coordinator in case doctor forgot to send them, and then same with the labs, send the orders to the patients even though they're transmitted to the labs, and then same with any DI orders that they're faxed to TVI, and then also send them to the patients as well.
Oh, that's awesome. So this is more of an end of the day so that you're not trying to manage a month's worth.
Yes.
Yeah, that's awesome. I think that's a great way to manage your referrals or those orders. So let's kind of start a little bit with chatting here. So we've got the management approaches. There's multiple different approaches and practices, and there's no right or wrong way to do it, but you want to make sure that they're consistent. So there's the manual ordering process. Some people are using like a hybrid version, which is fine, but making sure that it's simple. This process is very simple to use, but it's also highly prone to errors and potential lost documents. So just making sure that you have a very solid plan in place for that. Most of us are using our EHR systems for referral management. This is going to significantly reduce errors in the process. But it's also going to take some significant investment and training from your team, but it's a viable way to track and manage these. Ordering management software. Do any of you use a separate management software for your labs aside from your EHR? I'm curious. No. Yeah, none of you are. Okay. So I will say that this does offer some more advanced features, but it could be costly. So and then often these softwares do have, and there's so many of them out there, but they do have a better tracking and analytics and also customer service. However, there are ways that you can manage these by using the labs portals, the imagings portals. I made sure that I had access to all of those all the time. So, and I worked with the field reps typically for those. So I make sure I have a key contact for Quest, make sure I have a key contact for LabCorp, whoever we're referring to, so that in the event that we have any challenges or want to work on best practices and communicating, that we were able to do that. So I strongly encourage that. Another way to make sure that you have that portal access is for visibility on partial tests. Knowing when your patient's scheduled is going to be very important. And you can track all those things too. That's a management approach that you can certainly use.
A lot of things people don't know on that too. On TVI, you can extend that search date and then it will show
Oh,
you any future appointments that they have so you can tell whether or not they're scheduled. And then, like you said, it gives you a list on the TVI portal of who your office is ordered for and who's been done and who's been scheduled.
oh, that's awesome, Becky. Thank you for sharing that. I think that's that exactly. So if you're utilizing these things, that's going to be very important in your management tracking to make sure your patients are adhering to the protocols that they were given. And also, if your team is checking those things on a regular basis, then yeah, they're able to update the physician or the chart or what have you. So great. Thank you for adding that. Dedicated coordinators. We talked a little bit if you didn't join us last week, we talked about the referral management system as a whole, referring to specialists. And how important it is to have a coordinator, someone that's focused on that. But in this case, you also want to have someone with eyes on that. Like Jamie said, it's her MAs at the end of the day checking on that. You want to have someone or a team of people that are working on those things to make sure that nothing's falling through the cracks. We want to make sure that our patients are cared for. So that's a great management approach there. And then obviously using the patient portals are going to be important. Telemedicine, obviously, as a way to pre-order, if you will. So say you have a patient that's coming in for a physical, you want to do their lab review. You can certainly order those things in advance through either a quick telehealth or even just a quick phone call. So those are ways to obviously manage that as well. So I'm going to just pop in here because, again, most of us are using automated EHR systems for these, but do you have everything turned on that it's capable of? Sometimes people are kind of using half manual process, half EHR process, and that's okay. Again, if you have, as long as there's a good system in place, but there are a lot of things that people don't even realize can be automated through the EHR, like status tracking and, communication with the imaging centers or the lab departments. And if you have enough patients and you have a great relationship with that marketing rep or that field rep, you may be able to get that integration for free if you don't already have it. So I really did leverage my relationships to make sure that we were having, getting all the benefits that we possibly could for our patients. Obviously, alerts and reminders are going to be a great automation tool. Your patient portals, reporting and analytics. This is very important because anything that goes into your EHR can be pulled out. So that's a great way to see if any of your patients have fallen through the cracks too. Maybe Jamie, as a follow-up to your new plan, is once a month you do one quick tracking to make sure everyone's been contacted or whatever that the case may be. So very important and a great tool. So let's talk a little bit about, so now we understand, those management approaches and we're talking about those things. Let's explore how tracking these orders can enhance the process of the overall patient care. So actually I'm going to ask you a question, see if I'm going to quiz you a little bit. What do you think is the most important reason for having a tracking system for your lab and imaging orders? The most important. I'm going to take a drink because I'm talking a lot.
Make sure your patients are being taken care of.
That's it. Patient safety. You got it. Exactly. Yes, of course. It's going to make sure that all those test results are coming in, that they're being tracked and effectively communicated. This is going to reduce risks and especially delay in diagnosis. The longer you have to wait, the more complex the condition could become. Also, enhancing patient safety, obviously very important or patient care, pardon me, to make sure that those treatments are being, either patient came in for a reason, we want to make sure that those results are reviewed and timely to give them that care that they need. Obviously, increased efficiency, streamlining your workflows is going to reduce all those administrative burdens. And this is going to allow your healthcare team to focus more on patient care and, cannot be understated. Reducing legal risk. You want to try to do everything that you can in your practice to reduce the risk for a malpractice claim. They're going to happen, but if you have a great tracking system in place, you can say, listen, we tried to call Mrs. Smith. We called her 4 times, in fact, and, making sure that all those things are documented. So very important for making sure that you're keeping your practice safe. You can't just send your patient off. Here's your lab slip. I did my job. You actually are the leader in this case.
Hey, Sandy, I just wanted to jump in is that, we've worked a lot with NorCal Group and ProAssurance over the years. And, whenever they present, one of the very, very big things that happens is something called delayed diagnosis. And this is one of the key things is that the lab work or the test, it gets done, and then somehow it doesn't get back through and to make a clear messaging back to the patient. And so this is one of the things that every practice does routinely all the time in having these tests or referrals or whatever it may be. But it is just vital to protect our physicians to make sure that we have a good process in place.
Yeah, thank you, Richard. Absolutely. Yes. And like I said, it is imperative that you follow up. That, you are the leader, you're the ordering physician, you're the one that's in charge of the patient. And so you can't leave that up to the facility that's receiving the imaging order or the lab order. You certainly can't leave that up to the patient, as we know, they're not always their best advocate. So just, making sure that you have a follow-up process for that is going to keep you at lower risk. And that could be a initial phone call attempt or looking through that portal to see if they're scheduled. You really should be making 2 or 3 attempts to try to get in touch with people, especially if you're reviewing any abnormal results. And then automating a reminder so that after a month goes by and you still haven't heard from your patient, that maybe you're reaching out to, depending on the result, of course, that you're reaching out to an emergency contact. Of course, being careful not to share any HIPAA privacy data. And then to Richard's point on the ProAssurance, we do have a lot of on-demand. So if your clinicians you're seeing a lot of issues with either your staff or your clinicians, ask me about these trainings that you can actually provide to your team. I'm happy to help look for those, or we can customize something that works for you. Remember, one-on-one practice management support. And so let's talk a little bit about, well, we still have plenty of time. So let's talk a little bit about having a good tracking policy in place in your practice. So what does that look like exactly? So your policy, remember, this is your policy procedures related to these orders. It should define the processes with clear documentation and the communication of the orders. And this policy should include your clinicians, how your staff, how you expect your staff to handle orders and scheduling. Even the patient's roles should be defined in this. Having a tracking system, we talked about that. Whatever method you're using, make sure that there's a tracking system with reliable way to monitor. And then, of course, we'll talk about this a little bit, but reviewing it on a regular basis cannot be stressed enough. The tracking system, that is. Timely review and communication, making sure you have protocols to review the results with strict timelines. This lab result needs to be reviewed within 24 hours, or this should be reviewed immediately, depending on the nature. Or maybe the policy can include who it's assigned to. For example, the MA reviews first, then goes to the clinician. But making sure that that policy is in place. Also sharing the results among the team care. So who do you direct the communication to? Who are the alerts for abnormalities going to? Those types of things should be clearly documented in your policy. Obviously, Richard mentioned the follow-up procedures are going to be very, very important. This is going to keep your practice protected. So keeping sure that you have a protocol for addressing those abnormal findings. Maybe even adding like a script for sensitive discussions would help. That, your patients can say, oh, if they're having additional concerns, step 2 would need to be in place. And that's maybe scheduling an additional telehealth visit with the doctor. Whatever needs to be happen, make sure that it is clearly documented in that policy. Documentation, patient education, obviously making sure that that there are protocols in place, that there's records of the order, there's records of the results, maybe a checklist to make sure that the loop was closed. Patient education is going to be important in, making sure that they have everything they need to know what they need to bring to the test. For example, say maybe it's for their CAT scan and they have a series of things they need to complete, fasting or what have you. Making sure that they know all of those things are going to be important as well. And having those types of education pieces as part of your policy is going to be very key. And then the last, and of course I'm going to say it again, regular review, feedback, and training. Make sure that these things are addressed. I would say like with Jamie on, maybe as an as needed basis, see how this is working in a week or so. And do you guys need to make any tweaks to that? But you should be at least looking at this on a regular basis, specifically to avoid risk. I also would recommend testing your employees if you can at all, just even if it's in an impromptu meeting or during an office meeting, is to test these policies for patient safety. You want to make sure that your staff, your team, is adhering to the way that the practice would like, or that the clinicians would like your patients to understand. So having those in there is also going to be very important. I'm going to stop right here for a minute. I'm going to take a drink, see if you guys have any questions about the policy specifically or procedure manuals. Do you have one? I'm wondering if you guys, like, when I left my last job, I had a policy and procedure kind of related to everything. And it was very helpful as a reference guide.
That's what Becky's currently working on, a whole policy manual for all new employees and everything. So she's actively printing and adding constantly all the new policies or additional things that, you know, come up in a medical field.
That's great. Yeah. And Becky, if you'd like our support on that or anything that is missing, please let me know. We could certainly expand on this tracking policy and procedure for as long as you need to, but I love that you're just constantly looking at it, making improvements.
I may take you up on that.
Please do. And Jamie knows how to get in touch with me if you don't have my contact info. So let's talk a little bit. We have a little bit more time here. Let's talk a little bit about patient engagement and education. I wonder if you guys have anything like clearly communicating the processes of your labs. So for example, maybe having like a brochure or some sort of an infographic that explains the procedure. For certain ones, like I mentioned, prepping for a CT scan. Do you have anything like that in place?
I have educational handouts, but I couldn't tell you as whether or not they always use them. Some of them do.
Yeah, well, that's true. You can lead a horse to water, but you can't make them drink, I think is the saying. Yeah. So, you know, you can have procedural education sessions, obviously, or phone calls for something that maybe is a little bit more risky or complicated for the patient. You can certainly add those protocols in. Make sure that whatever the information is, that it's simplified language for the patient, obviously. I will say that addressing common misconceptions is going to be very helpful too, when ordering things like MRIs. You know, a lot of patients feel like MRIs aren't safe. And so giving them or having some information on debunking some of those myths, or to just explain the importance of why we need this or this MRI. There may be some safety issues involved, but the majority, this is a sensitive test that needs to be performed, and you know, making sure that your patient understands that and that they feel cared for is going to be very important. Utilizing technology, this is going to be, of course, your patient portals, or you know, anything that you can help to bridge any gaps in care for your patient. We recorded a training video on how to use the portal, when to use it, you know, how often you should be checking back with your care team. And we sent it in our welcome pack. Anytime we had a new patient, we said, hey, welcome. We have this, you know, my chart for you, whatever that was. We used Elation at the time. And we were using it as a way to teach our patients. And then lo and behold, even, you know, Mrs. Smith, little granny, would get on the portal and message us. And she was able to have that reference guide in case she had any questions. Also, you know, again, knowing when to reach out to us is going to be important too. Encouraging questions and feedback obviously is going to be important, you know, creating that environment where patients feel welcome to ask questions anytime, especially related to sensitive tests. Or just having that, when for you, Becky, you're creating this policy and procedure. If your team is talking with patients, make sure you say, hey, my name is Becky, my name is Sandy, whomever. Let me know if you have any questions either before or after this test, or just send us a message through the portal. We are here for you. So that's going to really help to engage and educate your patients, teaching them how to be part of your practice, teaching them when, a result is imperative to get back to them. Whatever the case may be, teaching them is going to be really helpful in reducing risk, reducing burdens in your practice, reducing those constant phone calls. So hopefully that'll help.